Top 5 things to know about medical imaging of your sinuses. Number 1, the gold standard for medical pictures of your sinuses is a CT scan or a CAT scan. It's the same thing. That beautifully shows the bony anatomy of the sinuses and the soft tissues around them. Number 2, do not get a CAT scan of your sinuses if you have an active infection going on, because we know it's going to be abnormal. It's not actionable to determine if you need to have sinus surgery done. Number 3, the time to get a CAT scan of your sinuses is if you have the diagnosis of chronic rhinosinusitis, you've been on maximum medical therapy for a couple of months, and you're trying to determine if you need to have surgery or if there's any other pathology going on. Now, of course, there are nuances and exceptions to every single one of these. Number 4, do not waste your money on an x-ray unless you are literally too medically sick to go down to the CAT scan to have it done, because an x-ray is so much less specific and helpful than a CAT scan of your sinuses. And lastly, number 5, your primary care provider is going to be tempted to want to order the CT scan of your sinuses on your behalf if they're thinking about an ENT referral. But I caution against this, because a lot of ENTs nowadays will use a special image navigation protocol with their CT scans. And if your CT scan is not ordered with that protocol, you will likely need to have it repeated if you are determined to need to have surgery. And insurance companies don't like to pay for 2 CT scans of your sinuses. So I would wait to have your ENT order exactly what kind they want if they think that you're appropriate. CT scans of your sinuses traditionally do not have IV contrast. So if you have a shellfish allergy or an iodine allergy, you should still be safe.